Welcome everyone to our NCAA Social Series. I'm Andy Katz, pleased to be joined by Dr. Brian Hainline, the NCAA Chief Medical Officer. Been with me, if I'm not mistaken, almost every week. We are in episode 19 now, believe it or not. And we're honored to be joined by Dr. Leon McDougle from The Ohio State University Wexler Medical Center, also a member of the NCAA Coronavirus Advisory Panel, and just recently elected president of the National Medical Association. That's where I want to start, Dr. McDougle, about, first of all, how that organization, your work with that organization and what you're doing at The Ohio State University, how that affects what we're seeing with coronavirus, certainly in the Black and brown communities, which are disproportionately affected by this dreadful disease.
Very good question, Andy. So this involvement with the National Medical Association started with a collaboration with the Rainbow Push Coalition and Reverend Jesse Jackson. And you said it, sports is very important, and many members of our community are actively engaged in sports, collegiate athletics, and also at the professional level. As you know, 65% of the NFL is African American, 78% of the NBA is African American, and our concern was we were hearing various stories from campuses in regards to COVID-19 infections with athletes, and didn't quite see what the protocol was that was overarching the various conferences and schools. So Reverend Jackson convened a meeting with President Mark Emmert and Chief Medical Officer Brian Hainline, and we had a really good discussion. And prior to the release of the resocialization protocol, and we had dialogue and helped contribute our concerns to this lack of relative transparency, really wanting to assure that the guiding principle of beneficence was being used to help ensure best interest of athletes and their families. The National Medical Association, established in 1895, we represent the collective voice of physicians of African descent, over 45,000 in the United States, and this is an important issue.
And I want you to jump in on this on the back end, Dr. McDougle, but I want to get your take on this, Dr. Hainline, and we've heard this throughout the course of the last 4 to 5 months, that so many people, and I'm not saying a blanket statement that athletes of color come from disproportionate communities, but some do. Some live in multi-generational homes. Some families certainly work in the service industry, the medical industry, as nurses, aides, working in hospitals. And there's a lot of, where they have to go to work. And, it's a major concern about when they're back home. The numbers show it. What have you taken from that, Dr. Hainline, about what can be done about that, what the data has shown as to why those communities are being affected more?
Well, Andy, I think what COVID-19 has really laid bare is that there are really massive discrepancies in our society. And these discrepancies are based on institutionalized racism. They're based on socioeconomic issues that are very hard to shift unless we really move in a proactive manner. And so, it's very different if you're a white person in Manhattan and you can socially distance out in the Hamptons, versus if you're an African American in Manhattan and you're living in a building where you have to share the elevator with 20 people to get to work. And so that's just not how it is for everyone. But if you look at the statistics, it's very clear that there is a divide, and it's a notable divide. And then we also have to extend that to athletics, and I think it's very important that this be an open and transparent discussion. So it's not across the NCAA at all divisions, but if you look especially at the divisions where we really see the NCAA on TV. So what most people know about the NCAA represents about 5% of the NCAA. That's what you see on TV. You don't see the 95% of the athletes who are competing in a lot of other sports. But of those 5%, it's disproportionately represented by African Americans, and also disproportionately it's represented by white coaches and white athletic directors and white commissioners. So that's a conversation we need to have. Why I'm grateful that we're working with the National Medical Association. I've actually known this group for some time. I spoke at an NMA meeting many years ago, and it was regarding tennis and issues that how tennis wanted to really try to work in a more meaningful way. But the NMA has always been a moral voice, if you will, of understanding that racism and social justice issues, these are public health matters. These aren't just political discussions. This has a drastic impact on public health, and that is equally important in the sport world. So that's why we have to be transparent, and I really welcome these discussions. And as Dr. McDougle stated, it was wonderful to speak with the Reverend Jesse Jackson and his team, and that's what led to my I'm grateful that that's what led to my meeting with Dr. McDougle as well.
So Dr. McDougle, if you want to add, what tangible aspects do you think going forward can be applied?
So one of the issues that we were concerned about and has been addressed by the NCAA. So say you're someone who contracts COVID-19, or you have a concern whereby due to underlying health conditions that you may want to opt out of the season. What's the NCAA's position on being able to maintain your scholarship? And the leadership spoke to that, recommending that students not lose their scholarship as a result of this opting out based on some of the risk involved with COVID-19. So in addition to that, even from an insurance standpoint, where we're saying, well, what's going to happen if a student, say their parents don't have good insurance, and we're talking about from Division III through Division I, and they contract COVID-19. What's going to be the responsibility of that university as it pertains to providing health care for that athlete? And that's student, and let me emphasize student athlete, and we spoke to that issue of concern because parents were really, with the Affordable Care Act, there's a provision about pre-existing illnesses. And so say someone has asthma or something of that sort and develops COVID-19, is that going to be something that's covered? We went through a number of concerns as it pertains to, one, that transparency. That's why I really appreciate the work of Dr. Hainline and the COVID-19 Advisory Panel.
So I want to shift to a couple issues that have occurred over the last couple of weeks, or actually more the last week, at the professional level and at the collegiate level. And that is, first off, and we talked about this, Dr. Hainline, earlier, and I want to get your opinion on this, Dr. McDougle. So in baseball, you've got an outbreak with the Miami Marlins. They're having to sit games out. And we've discussed this, and if we have the season we all hope in some form or fashion, if a team has what is deemed to be an outbreak and has to take itself out of competition, how much do we have to get to the point, Dr. McDougle, and this would be, certainly you're at the Ohio State University, so it would have to be in a place like the Big Ten, where you have to accept that there may come a point during the season, regardless of sport, that Team X may be removed for a couple of weeks. And you may have one team play 8 games, one team play 10 games, or whatever the sport is. And we have to move on if that team or teams have to be removed from competition due to the protocols being followed of quarantine if there is what is deemed to be an outbreak. Dr. McDougle.
So Andy, another great question, and speaks to the power of having a published protocol, because there's a whole section in here speaking to and providing parameters whereby a school or team may not be able to continue. So that's in this document. So now in regards to my opinion today is that of the president-elect, soon to be president on Monday, of the National Medical Association and a member of the NCAA Advisory Panel on Coronavirus. So that's my speaking vantage point here today. So the protocol has been published right here on the website. That provision is in there.
Well, Dr. Hainline, that's a shift that we've all had to accept here with the NCAA, that, you know, it can't all be equal. That if you're not ready to go, if you have to sit out, you got to sit out, and other teams are going to have to move on. I'm curious, just what have you seen in terms of that acceptance of that's the place we're in right now, that not everyone's going to be able to participate or may not be able to participate as we go forward?
Well, Andy, I think that's not only accepted, it's anticipated. And so when you see, let's talk about football, that schools are decreasing the number of games that they have. A part of that is that, you know, then you aren't really counting on the fact that you're going to be playing one week after the other, and it allows for a little bit of flexibility if there has to be more downtime in a team. Because, you know, when you think about it, with quarantine, which is different than isolation, you could be newly infected with COVID and return in 10 days if you're asymptomatic or have minimal symptoms. Those are the CDC guidelines. But quarantine, if you're a high contact risk exposure, that's 14 days. And what's not clear, you know, so we've been talking to our counterparts in rugby and soccer and Europe and elsewhere, and what constitutes a high risk contact in these sports, and it's not crystal clear. But so you're seeing that evolution. You're also seeing that we're having really very serious discussions at the championship level. What's the minimum number of contests that you need to play to have a national championship? And that's going to be decreased considerably as well. And so all of this is taking into account the fact that there probably will be downtime for teams, because that's the right thing to do. That's the safe thing to do. You know, if we're able to even proceed in a manner that we believe can be safe going forward in the season. So yeah, these conversations are having, I mean, I've had them, you know, we talked about it for a couple hours today as well. So, and I was on a call with the A5 Medical Advisory Panel last night. So yeah, we're all in that same place, and we know it's likely going to be a shortened season, less games, and we have to accommodate for that.
Dr. McDougle, the elephant in the room here is not the practice field. It's not the game. It's the other 20 hours of the day. We've talked about this last couple of weeks on this show, and we're seeing again, Rutgers was the latest team to have to sit down and not participate for a little bit. You know, and a lot of it has to do with what happens off the field. How can administrators, athletic directors, conference commissioners, coaches, and most notably leaders within those locker rooms emphasize that this is not going to be a normal year? You're going to have to sit out the parties. If the bars are open, you can't go. If you want a season, you're going to have to treat it incredibly different, because clearly it is showing that it is off the field where the outbreaks are occurring. How does that message get through? So
another excellent question, Andy. So some schools are having the student athletes sign a pledge. They've been characterized as waivers, but they're not, at least from what I've seen used at the Ohio State is not a waiver, it's a pledge setting expectations of behavior when outside of the practice field. Also, it speaks to the strength of leadership on that respective team and the cohesiveness. Is everybody in it to win a championship? And I would think a great deal of this from a team perspective would also not only the coaches, the head coach, the assistant coach, but those team captains. Now that C on that jersey, it means something this year. It can make the difference on whether someone contracts COVID-19 and whether there may be some residual effects of that if they don't just have an asymptomatic, no symptom experience. So more than any year, that C, if you're the captain, you got responsibilities. But everyone's a leader on the team. That's what we say. I have a military background in the Navy. Is everybody's responsibility to lead. So all hands on deck. We all have to take care of each other and hold each other accountable. So that's going to be important now more than ever.
You know, Dr. Hainline, I don't want to put this at the feet of just student athletes. If this is going to work, the student body is going to have to embrace this as well in the next couple of weeks in August and into September. They can be told, 1,000 times, don't party, don't congregate. I don't know how it's going to be policed, but for all of this to work, how much do the students, the general student body, have to adhere to, at least in the fall until Thanksgiving, a new normal of what your social life is going to be like?
Well, it's critical, Andy, and it's playing out really well at some schools, less well at others, and it's hard to really figure out how you make that happen. I think part of that is the messaging from the university president, and part of it, as Dr. McDougle stated, it's the messaging of the student leaders. This is where I think student athletes can actually have a very active role. So, we've utilized student athletes to deliver messages about alcohol use, about substance use, and it's not that the responsibility is just on them, but they can be a subculture for the good, and I'm hopeful that will play out now. But we have to see. I remember on one of our NCAA Advisory Panel calls, and we were talking about other transmittable diseases, and one of the infectious disease experts said, well, we've been trying to get student athletes to use condoms if they're going to be sexually active for the past 20 years, but are they really hearing that message? It's a difficult population because they're, as young adults, and we said this before, their frontal lobes are still in the process of myelinating, and if you add with that impulsive decision making that can get worse under the influence of alcohol, it sets up a condition where things just aren't going to be good from the point of view of mitigating COVID spread. So everyone has to really just awaken and be enlightened that this is something very real, very serious, and we're all in this together. This is for the public good. This is really for the world good, and we need to really, in a humane manner, like hold hands and say, let's do this together. Although we'll physically distance when we hold hands, but
Look, Dr. McDougle, clearly the most successful way in terms of playing competitively has been the bubble. We know we can't bubble college sports. And obviously Major League Baseball is now dealing without a bubble, and we'll see what happens with the NFL. Outside of what I'm saying about hopefully that you don't party, you don't go to bars and those kinds of things, what's the closest that college athletes and maybe the student body can get close to a bubble-like life over the next 3 to 4 months to make this work?
Well, so one, I'd just like to bring up the point that with our discussion with the NCAA leadership, we spoke to how will students who contract, student athletes who contract COVID-19, how will they be tracked long-term for outcomes? And and that's something that's part of the NCAA protocol in regards to adverse injuries and things. So that's going to be tracked. So I think, Andy, that is a very good question from a standpoint of, we spoke to some of the issues in regards to physical distancing, wearing a mask. I know for football, to even continue upon that, there's a facial shield. But that's where collecting data and the testing requires a test availability within 72 hours of competition. So that's a point, Andy, where if that school or collegiate program can't produce those types of timely results before the athletic competition takes place, that's another safeguard. So there are safeguards, but what I would also speak to, my answer to your question is this: we need a national plan. We need to evoke the Defense Production Act and crank out these testing kits, crank out this PPE. There is no excuse that we haven't done this. And we need a unified voice at the very top of our leadership in this country to speak to this issue and take it seriously, because you got half the doggone country not wearing masks because they're following the lead of our national leadership, and it's tragic. So that's my answer. National leadership.
One last topic I want to dive into real quick, Dr. Hainline, and then Dr. McDougle on the back end, and that is the mental health right now of the student athletes. I know as a father of a prospective student who's supposed to go in the fall to Northwestern, not as an athlete, but as a theater major, I'm dealing with the stress right now of, you know, they're going, hoping that it stays that way. There's a lot of stress with that. Now take the student athlete. Are we playing? We're seeing right and left leagues at all levels of Division I, II, III, no fall sports. So that's happening. Or in the case of Michigan State, the whole program had to shut down for 2 weeks, quarantine. The mental health aspect of that. Are we still going to play? This is happening right now, and it's going to continue. Dr. Hainline, how concerned are you of that mental health aspect of this unknown and this start, stop, quarantine, not quarantine?
I'm very concerned, Andy. We did a survey on over 28,000 student athletes, and we're using that actually as a springboard for a task force that we're going to have in August 10th and 11th, that will specifically address the mental health concerns of student athletes of color, because in this survey, we found that student athletes of color were disproportionately negatively impacted on different mental health measures. But all student athletes, the aggregate, are disproportionately negatively impacted in terms of depression, anxiety, some even exhibiting post-traumatic stress disorder symptoms. So this is very real. And when we talk about mental health, it's not just something that's out here in some sphere in a halo or something. That's very real and very physical, and it impacts your physiology and so much of your overall health. So we're deeply concerned. We're addressing it, and but the other part of it is that the student athletes are staying really connected to one another and with their coaches, because they still need a day-to-day rhythm that is somewhat predictable within this vast unpredictability, and we keep emphasizing that as well.
Dr. McDougle?
Andy, I'd like to commend Kevin Love. He purchased subscriptions for Headspace for UCLA student athletes. So that app for mindfulness to help student athletes cope with stress. And let me take it a little bit further. I spoke to you about my Navy background. Well, we would deploy on a ship for 6 months at sea. I'm deployed, my spouse, my wife is deployed, my family is deployed. So yes, it's the student athlete, but you have family members that are concerned about, so you've sent them into a situation where they're not sequestered at home. Now they're going into another environment. And so I think and that family is the support system many times for the athletes. So if you have the family at stress and perhaps they don't have excellent insurance coverage, perhaps they don't have mental health services readily available. So it's a feedback loop. So I think we need to also speak to that family unit as it pertains to stress and well-being of that student athlete.
Dr. McDougle, I just want to give you the last word. I'm not going to put you on the spot. Things are changing daily, hourly. How optimistic are you that we will have some fall sports, college football, at least at the Power 5 level, in the next couple of months?
So I'm going to answer your question by saying this. We're going to follow the science. That's what we're going to do. We're going to look at, we're not sticking our heads in the sand and pretending that data doesn't exist. Science doesn't direct us where we need to go. So that's where it will be important to see how things go with these tests that we've recommended, the turnaround time, that will, and then I'm not going to let the nation off the hook. We need national leadership, and these folks out here not wearing masks, so put it this way. So everybody out there wearing masks, you're helping to prevent college athletes, college athletics from competing this year.
Dr. Leon McDougle, congratulations on your election as president of the National Medical Association. That'll start next week. You are from The Ohio State University. We appreciate Dr. Brian Hainline, as always, the NCAA Chief Medical Officer. This is episode 19 of our social series. It's great we've been doing this every week, but it also indicates how long we've had to do this, because certainly we're showing how long it's been since the pandemic began. At least we've been paying attention to it. We're going to continue this throughout the course of the year, every week. Every week there are more things to discuss on this. You can go to ncaa.org/social series to see all episodes, all 19 of them archived. More than anything, stay safe. We'll talk again next week, hopefully with even better news. Thanks for watching.